Hey everyone, welcome back. So let's talk today about logotherapy. So how would a logotherapist treat OCD, Obsessive-Compulsive Disorder? All right, so let's take a look here. Logotherapy, with its focus on meaning and existential choices, offers a unique lens through which to approach obsessive-compulsive disorder. While it wouldn't replace evidence-based treatments like exposure and response prevention, ERP, for OCD, it can be a valuable complementary therapy, particularly in addressing the underlying existential distress, the relentless search for certainty, and the meaninglessness that often accompanies the disorder. Here's how a logotherapy therapist might treat OCD. Understanding the will to meaning in the face of OCD. The existential vacuum. Many individuals with OCD describe a profound sense of emptiness or meaninglessness that their compulsions attempt to fill or control. The therapist would explore this existential vacuum, helping the client recognize how their obsessions and compulsions, despite being distressing, might be a misguided attempt to create order, safety, or purpose where they perceive a lack. Redefining purpose beyond compulsions. The goal would be to help the individual discover or rediscover sources of meaning that are independent of their OCD symptoms. This involves guiding them to identify their values, passions, and what truly gives their life significance beyond the all-consuming cycle of obsessions and compulsions. Addressing the search for certainty. Uncertainty as a given. A core tenet of logotherapy is that life inherently involves uncertainty. For someone with OCD who desperately seeks absolute certainty to alleviate anxiety, this concept can be challenging but ultimately liberating. The therapist would help them confront the fact that some questions have no definitive answers, and that meaning can be found even in the face of ambiguity. Shifting focus from what if to what for. Instead of endlessly engaging with what if scenarios that fuel obsessions, the logotherapist would encourage the client to ask what for. This shifts the focus from the content of the obsession to the purpose behind the compulsion, and more importantly, to the larger purpose of their life. Key logotherapeutic techniques applied to OCD. Paradoxical intention. This is a particularly powerful technique in logotherapy for anxiety disorders, including OCD. The therapist would encourage the client to wish for or exaggerate the very thing they fear or are compelled to do. For example, if a client constantly is washing their hands due to a fear of contamination, the therapist might encourage them to intentionally imagine getting more contaminated, or even try to be as dirty as possible in a safe, imagined way. The humor and defiance in this act can break the cycle of fear and the power of the compulsion. The idea is to disarm the fear by taking away its gravity. Viktor Frankl noted that the more the patients fight their obsessions and compulsions, the stronger their symptoms become. If one succeeds in making the patient stop fighting the obsessions and compulsions, and this may well be accomplished by paradoxical intention, these symptoms soon diminish and finally atrophy. Dereflection. This technique aims to redirect the client's attention away from their problems and excessive self-observation. For OCD, this means shifting focus away from the obsessive thoughts and compulsive urges and towards something meaningful outside of themselves. For example, instead of obsessing over whether they lock the door, the therapist might help the client focus on the responsibility to their family, or a creative project they are working on, or the act of helping someone else. The goal is to encourage self-transcendence, moving beyond self-preoccupation. Socratic dialogue. Through carefully crafted questions, the therapist helps the client explore their values, beliefs, and potential sources of meaning. This can help them uncover the underlying fears and anxieties that drive their OCD, identify how their compulsions are interfering with their ability to live a meaningful life, discover new perspectives on their suffering and potential paths to meaning despite their challenges, and challenge the irrationality of their obsessions by guiding them to reflect on their own wisdom and values. Finding meaning in suffering. Logotherapy acknowledges that suffering is an unavoidable part of life. For individuals with OCD, this involves helping them find meaning in their struggle rather than merely trying to eliminate it. This could mean finding strength, resilience, or empathy through their experience with OCD. It's about choosing their attitude towards their condition and recognizing their freedom to transcend their symptoms by focusing on what makes their life worth living. Integration with other therapies. It's important to reiterate that logotherapy is often best utilized as an adjunct to established evidence-based treatments for OCD, particularly exposure and response prevention. ERP directly addresses the behavioral and cognitive components of OCD by systematically exposing individuals to their feared situations while preventing compulsive responses. Logotherapy can provide the overarching motivational framework, helping the client understand why they are doing ERP, and connecting the difficult work of confronting their fears to their deeper values and purpose. This can significantly enhance motivation and adherence to treatment. In summary, a logotherapy therapist treating OCD would not directly target the symptoms in the same way an ERP therapist would. Instead, they would focus on helping the individual find meaning, purpose, and responsibility in their lives, utilizing techniques like paradoxical intention and de-reflection to help them disengage from the obsessive-compulsive cycle and to re-engage with a life of value. This existential approach can be a powerful complement to traditional OCD treatments. So what do you think? What do you think about using logotherapy to treat OCD? Would you want to try out this technique? Let me know in the comments, and I will speak to you next time.